In this video, I want to talk to you a little bit about the clot issues that we're seeing with the AstraZeneca vaccine, some updates there. I want to talk a little bit about eye protection and why, especially with the new variants, eye protection is something that I use, and it's something that I think people should consider, and I do have some evidence for that. We'll touch a little bit on variants of concern, and I also have an interesting study that explains a little bit about why we are seeing men be more severely affected from COVID-19 than women. Not in all cases, but it has been a bit of a theme. And so there's an interesting study that I think is worth taking a quick look at. So we'll do that as well. Hello and welcome to this video. My name is Lindsay Dixon and I'm a pharmacist from British Columbia, Canada. I've been reporting on COVID-19 since March of 2020. Let's have a look at the evidence we have today. Hello, so we will talk about VIT. What is VIT? T cells, as I mentioned, eye protection, why it's important and why we should maybe consider this, and something about variants of concern here. First, I'd like to make a clarification. So I was on an interview with Dr. John Campbell from the United Kingdom last week, and I stated in the interview that 1 in 45 Canadians with COVID-19 had died since February. And I don't think that I communicated that very clearly. So that was based on this graphic here that was posted on social media on April 9th from Dr. Tara Moriarty. And Tara Moriarty is a scientist. She is a professor at the University of Toronto. She also runs Moriarty Labs, and she has been tracking COVID-19 cases and deaths, particularly in long-term care, but also just overall. So the stat that she had posted was that since February of 2020, 1 of every 45 Canadians diagnosed with COVID-19 has died. And a couple of viewers pointed out to me that that wasn't accurate, and I may have said 2021 in the interview. And then also, this can be skewed a little bit because we did see more deaths definitely in the first wave, which was back in March in the spring of 2020, than we're seeing now. So I wanted to make that clarification, and thank you to the viewers that did point that out. I really appreciate this type of peer review, and I always read your comments, and so I am glad that you are definitely keeping me accountable, because I definitely want to give you the best and most accurate information. So I hope that that is helpful, and I hope that that has cleared things up. So yesterday, Canada reported our first death from a cerebral blood clot. And this person did receive the AstraZeneca vaccine. Now, it is unclear as to whether it was caused by the vaccine. However, it was a cerebral blood clot. This person had had the AstraZeneca vaccine, and so you can draw your own conclusions from there, but it will be investigated. This was reported out of Quebec, and so far 400,000 doses of this vaccine have been given in Quebec. The woman was 54 years old, so she's very young. She'd had the vaccine, the AstraZeneca vaccine. Quebec does have 3 other blood clots under investigation right now. These are cases, not deaths. These are people who have reported a blood clot or been hospitalized because of it, possibly being treated at home now, which is often what happens. So 860 people aged 50 to 59 have died from COVID-19 in Quebec thus far. And this puts us at about a 1 in 100,000 risk factor for getting a blood clot from the vaccine. So when we look at how many people have died from COVID-19 versus how many people have died from complication, a very rare complication from the vaccine, it does put it in a little bit of perspective. That being said, I don't want to diminish the terrible event that this is for this woman and her family. And it's just really, really unfortunate. And I do believe that there have been 2 deaths from men in Australia just yesterday. And they believe that that was due to the AstraZeneca vaccine as well. Now, John Campbell has talked about injection technique and the issue with aspirating or not aspirating. And I am fully aware, and a few viewers have told me about that. And I have written some letters, and I've been trying to draw that to the attention of some people, because I do think, I just wish that they would look at this. because maybe she didn't have to die. And I don't want to say that that's why she died, because I have no evidence for that whatsoever. But I do think that we need to look at something as simple as this, as just changing our vaccination technique and seeing if it does make a difference. Now they've renamed this syndrome, and they are calling it, last week I think I reported that they're calling it VIPIT. Now they're calling it VIT, so vaccine-induced immune thrombotic thrombocytopenia. Okay, so I wanted to give you that update. Now, the risk of blood clots with the AstraZeneca COVID-19 vaccine, I found this graph to be quite helpful, quite accurate. So the potential benefits and harms of an AstraZeneca COVID-19 vaccine. We have to remember that with any medication or any type of treatment, there are always risks, and the risks can be very severe. And then we also have to weigh that with the risk of COVID, and we've talked about that on this channel before. So on the left, you see potential benefits done by age category. You see the ICU admissions due to COVID-19 that are prevented every 4 weeks with the vaccine. So that's on the left there. And then on the right, you can see the potential harms due to the vaccine categorized by age group. And so the benefits definitely still outweigh the risk. And unfortunately, the risk of COVID-19 is very, very real in many parts of Canada and many parts of the world right now. So this is the situation that we are in. So just wanted to show you that, and hopefully it's helpful, and I will put a link to this at the end of the video. So how would VIT manifest? And we've shared these symptoms before, but if you want to take a screenshot and share it with someone, it may be helpful. It usually happens 4 to 20 days after vaccination. We can diagnose it and we can treat it, especially when we catch it early. And so sudden onset of severe persistent headaches, blurred vision, skin bruising, that would be like severe skin bruising, or bruising that when you touch like a glass or something to the skin, that's usually more like red spots. They don't disappear. Swelling or coolness in an arm or a leg, chest pain, or severe abdominal pain. And these I just got from Health Canada. Health Canada has posted these symptoms. So that is hopefully helpful for some. So some people in the world right now, I think of India, Brazil, different places, even some places in Canada, people are dealing with COVID-19 at home. And the thing about COVID-19 is it can turn really quickly. It can turn from being a very mild disease to something extremely serious and needing hospital care within hours. And so I thought this graphic was helpful. And what it shows is that with early COVID-19, if you're managing this at home, if you're able to get a pulse oximeter, that would be helpful. Mask yourself and family to protect everyone. And this was not such an issue as it is now. So it used to be that you only had about a 17% of passing COVID-19 onto your family if you lived in the same residence. Now, with the variants of concern, we are seeing one person get ill in the house and it goes through the whole family. So masking is one way that we can help to prevent transmission in the house, especially when people haven't been vaccinated. Opening the windows and doors to ensure proper ventilation, staying home and resting, of course, stay hydrated. You can use Tylenol if needed. Now, if your oxygen saturation is over 92%, you can continue to use Tylenol if needed for pain or fever. Water and fluids as needed. You do not need a lot of water or fluids, but a little bit of fluids is good. It helps with hydration. It helps your body to stay a little bit hydrated. And you can stay prone on your stomach. That helps to take the pressure off your lungs so your body can get more air, more oxygen into your lungs. Now, this budesonide steroid is something we talked about last week, and it is something that the BC CDC has now on their options for therapeutics. And it's something that is only recommended for mild COVID-19 that is being managed at home. And this is still preliminary studies, but it is being now incorporated into the therapeutics, which I think I said was probably going to happen last weekend. So, I mean, all options that we have that can help to minimize severe disease and death. I think are valid. So if your oxygen saturation is less than 92%, you need to seek hospital care if possible. And then there's the different therapeutics and the different strategies that would happen in hospital. So I thought this was a helpful graphic. Zane Chagla is part of COVID-19 Resources Canada, and he did this graphic with Dr. Kupali. I just thought that you might want to see that. Let's look at India and Brazil quickly. So these are the variants that we have in India and Brazil. And if you look at this graph, this is from December 2020 until present date. So look at the terrible time that Brazil has been having this entire pandemic due to a lack of leadership, many people not believing the science, not believing that COVID-19 is real. I mean, you can imagine as a citizen going through what they're going through in the country. Now, it does look like their curve is coming down a bit, whereas we see India and their curve is increasing, and it is expected to continue increasing for the next at least 3 to 4 weeks. And we all know that what's going on there is really devastating. Just quickly here, Brazil, India, Canada, and the US, and I thought this was an interesting contrast. This is cases per 1 million people. You can see Canada seems to be trending down now. United States also trending down, largely due to vaccinations. Brazil's flattening, but you can see they're still very high. India is also rising and will continue to rise and probably exceed Brazil. But I do also want to point out, as I love to point out, these countries that have applied and strategized with what we know as a COVID-0 approach. These countries, like New Zealand, are not part of these waves that we see, these openings and closings of the economy. They've really got their testing and contact tracing in order. They've got their borders well managed, and you can see that they're really not experiencing even the mental health impacts to the degree, I would guess, that we are in countries like Canada and these other countries here that are on the graph. COVID-19 cases per 1 million people. I just wanted to show you this. This is what we've been through. And again, I've put Brazil, India, and Canada on the graph there. But also, if you will notice, Israel is at about 60% of their population has been vaccinated. The UK, they're at about 51%. These are first doses, and you can see the effects of vaccination already having quite an impact on these populations. And now these populations are looking forward and moving ahead, even though they do still have some transmission in their communities, but they will be able to gradually open up and move on to life that is much, much less restricted, and hospitals that are not overwhelmed like many have been. Okay, so for those who saw me on the John Campbell channel last week, I spoke about eye protection, and I spoke about these glasses that I use, and I use them in flu season to give vaccinations, and I will use them again. And the reason I use these glasses is because of Dr. Mary Fernando. And Dr. Mary Fernando I actually never met her, but I do follow her on social media, and she wrote an article months ago about the importance of eye protection, and I want to share just a couple little segments of that with you. So in the article, it was titled "Public Health Recommendations Around Face Shields Should Change." Now, if you did not see my previous video last week where we talked about aerosol transmission, I would recommend that you check that out, and I'll put the link right up here, because we are dealing with a virus that is airborne, and there is a bit of resistance among public health officials and some different organizations who are a bit resistant to this thinking. But there is ample evidence now that this is an airborne virus. So in the article, and there's a QR code to the full article if you want to read it, she says, "My husband added a face shield to his mask in indoor public places to protect his eyes during the second wave of COVID-19. One of our friends said that if using a face shield with a mask wouldn't protect his eyes from the airborne COVID-19, but goggles would. This statement was very surprising. Public health experts have been clear, given the airborne transmission of COVID-19, that face shields and goggles protect the eyes equally. For the public, Dr. Anthony Fauci said in an interview, you should protect all of the mucosal surfaces with either goggles or an eye shield. If you have it, you should use it. Brian Foody is someone that she spoke with. He is president and chief executive officer of Logan Corporation, an MIT-educated mechanical engineer who specializes in fluid motion. So he says, imagine two people wearing face masks. One has on a face shield and the other is wearing goggles, walking into a closed room where the ambient air contains COVID-19 infected aerosols. Whose eyes are better protected? What do you think? For our wearer of the face shield, with every breath, the clean air behind her face shield is ventilated and exchanged with the contaminated ambient air. Because of this ventilation, the air behind the face shield will have the same concentration of aerosols as the rest of the room within a matter of minutes. On the other hand, for our goggle wearer, the clean air behind her goggles is sealed off from the ambient air. And I started wearing these because in pharmacy, we are in a very small room with very little ventilation when we are giving vaccines. And I knew this from reading Mary's article. So I wore these, and I'll show you for those who didn't see they fit very, very nice, and they are anti-fog. They were not expensive, and I give the link. See, I don't know if you can see the little shield there. I'm sorry, they're not super clean. Anyways, I had a lot of people ask me about these glasses, and I wasn't expecting that. So I put a link for you in the description of this video. I'll put it there. And it is an Amazon affiliates link, so I think I get like 2 cents or something per purchase, but I don't care. I'm just putting this out there because I had a lot of people ask. But I should have presented the science behind this when I talked with Dr. John Campbell. So I wanted to give that to you today. So Brian Foody says the mixing of air behind a face shield is based on the scientific principle of fluid dynamics. If there are COVID-19 particles, they will be drawn in and up into the eyes. Okay, so there is a principle behind this. There is a reason behind this. I know that many hospitals have now switched to recommending goggles or some form of eye protection for people over a face shield, or goggles and a face shield. So now we are in the time of variants that are much more transmissible, and I think that everything that we can do to protect ourselves is helpful. So even when I go and get groceries, I just put these on. I put my mask on. It is important you get a good seal around the nose, which we've already talked about before, but it's also important so the glasses don't fog up. They really don't fog up. I was pleasantly surprised when I was giving vaccinations, and a lot of people didn't even know that these were actually safety glasses. So that was great too. So what are the chances of getting infected through your eyes? So there's a study with 3 rhesus monkeys that were infected with COVID-19, 2 via their conjunctiva, so the eye area, and 1 via the intratracheal route. The conjunctival swabs were positive for the first day only, indicating that the inoculated virus may transfer from the conjunctiva to the respiratory tract and other tissues. Specific IgG antibodies against SARS-CoV-2 were detected in the rhesus monkeys, indicating that the animal was indeed infected with SARS-CoV-2 and showing that the conjunctiva is a route of SARS-CoV-2 transmission. So there's the evidence for that. A literature review concluded the overall prevalence of ocular symptoms in patients was about 11.2%, which is not a common finding. So I'm assuming that they're saying that that is a fairly high percentage. And we know that some patients have reported with conjunctivitis. Actually, one of the physicians in Wuhan, I believe, one of the first physicians to die was an ophthalmologist and had been seeing patients with conjunctivitis. Nevertheless, this report prevalence might be an underestimation of patients with COVID-19 presenting with life-threatening clinical scenarios, and this may preclude a detailed ocular examination or relevant history. So I wanted to quickly touch on variants of concern because this is the world that we're living in now, unfortunately, is a world with these more transmissible and sometimes more lethal variants. So what is that looking like? Jens von Bergman is a great person to follow on social media. He's a data analyst and he has this website, mountainmath.ca. He does a lot of different data analyses and he's just posted these. So variant of concern cases. So you can see British Columbia, which is my province. You can see those cases back in January to pretty much nothing. And then that steady increase with the variants of concern. Ontario there is in blue. And then you can see Denmark as well. So this has been quite game-changing for the COVID-19 pandemic. And you can see how quickly these variants are able to dominate and become dominant. This is the QR code for this graph. And so I wanted to share that with you. Something more. The B117 and P1 variant in British Columbia. So Jens shared this graph, and even though it's just British Columbia, I thought you would find it interesting. There's the QR code for it. So he has graphed out from back in March until present day. And he's also mapped out here the different timings and closures and reopenings that we've had as an economy. So you can see over here, masks in stores and travel was discouraged as we were seeing these cases rise in November and into December, no private gatherings, and then we started to see things fall, but we've since been on quite a steep curve. And you could see that the wild type variant is blue here, and we see the wild type variant dropping off, and look at these variants of concern that are responsible for cases just rising up. And now we are gladly seeing some of our cases drop, so that is dropping off. So Jens says that if we only had the wild type virus that originally was the dominant form of COVID-19 at the beginning of 2020, we would be at about 110 daily cases now. And we know that British Columbia is averaging anywhere between 800 to 1,000 cases right now, and hospitals are becoming overwhelmed and it's quite complicated. So I just wanted to show you that because it shows how the variants of concern have really changed this whole pandemic. It really needs to be taken even more seriously than before, and all the measures that we take, the social distancing, the mask wearing, really needs to be, we need to be really committed to this right now, especially before we are vaccinated. Oh, and yeah, I wanted to circle that to show you. Sorry I didn't do that earlier. So T cells and the severity of COVID-19 differ by sex. This was a study that was in cell.com recently. Dr. Daniel Sabin, he's an associate professor in the Department of Ophthalmology and Immunology at Duke University, and I think that is in the States, possibly Texas. So interesting, he didn't have much to do at the beginning of the pandemic, and he had this 36 color flow cytometry device, and he decided he wanted to do some type of a study. So he started to analyze blood and tissue samples from COVID-19 positive patients to see if they were any different from healthy people. I mean, of course there's going to be differences, but what he observed was interesting. He observed a higher incidence of what we call mate cells. So these are mucosal associated invariant T cells in the blood of healthy women. These are specialized blood cells that contribute to immune defenses in mucosal organs and tissues. And we know that SARS-CoV-2 invades the body through these mucosal organs and tissues. So that was the first observance. They did not start this study with any type of particular hypothesis. They just wanted to observe if they could see any significant changes. And this was the first thing that they observed. The COVID-19 positive patients presented very few of these cells, but they were later found in an abundance of lung tissue. So the original tissue that they were studying, they noted that in COVID-19 positive patients, these cells were not very evident. And they thought, where did they go? And then they later did find that they had migrated or they were concentrated into the lung tissue, which makes sense because that's usually where we see the biggest inflammatory response, at least initially, in a COVID-19 disease case. Dr. Sabin has said that there are numerous examples of sexual differences in the immune response to infections, noting that those differences have been prevalent all along with COVID-19. And if you've been watching COVID-19 from the beginning, there has always been increased deaths and increased cases, especially severe cases of COVID-19 in men. That doesn't mean there hasn't been in women, but there's always been a percentage of men that are infected and get severe cases and even die. And that's always been a little bit higher than women. And we're still trying to figure out exactly why. And maybe this has something to do with it. Don't know. Our findings uncover a female-specific protective profile carried out by these mate cells, and this could potentially help guide the development of treatments and therapies. So they need to figure out what these cells are exactly doing and how they are being protective. Is it just by mere concentration, or is it by their ability to mobilize to a certain tissue? But this is a very interesting finding, and I thought you would enjoy hearing about that. And I've also done a video on vitamin D and the immune system in older adults, and that also talks about T cells. And so if you haven't seen that video, it's only a few minutes long, and I'll put the link right up here. And that caught my attention because T cells are becoming more and more of a topic in the COVID-19 era, and I think it's something we need to continue paying attention to. So I hope this update has been helpful for you. Thank you for your time, and I hope that you take care and stay healthy. Bye-bye. And if you're enjoying these videos, I would encourage you to subscribe and make sure you hit the bell icon to receive notifications of further videos as they come out.